Hello everyone, welcome back to MedTok with Corine, where healthcare is explained simply. Let me ask you a question. Have you ever had headache, fever, back pain, toothache, muscle pain or muscle cramps, and period pain and immediately reach for ibuprofen? If you're like most people, the answer is probably yes. Ibuprofen is actually one of the most commonly used medications in the world, but surprisingly, many people don't know a lot about it beyond the fact that it helps with pain. Depending on where you live, you may know it by different names. Here in the United States, the common brand names include Motrin or Advil, but in other European or African countries, they know it as Nurofen or Ibuprofen. But regardless of whatever names you find on the box, just know the active ingredient is still the same, which is ibuprofen. The good news is most people start feeling an effect after 30 minutes. It usually reaches its full effect within 1 to 2 hours and can provide relief for up to several hours afterward. Now, here's something most people don't realize. Just because you can purchase this medication over the counter doesn't mean it doesn't have risks. For example, taking ibuprofen can irritate your stomach. So if you ever take this medication and feel some stomach discomfort afterward, that could be why. Taking it together with milk or food can help lessen the stomach discomfort. Another thing to remember is that more is not always better. Sometimes when people are in severe pain, they feel like taking an extra medication is gonna help them feel better. Unfortunately, that's not the case. Taking too much ibuprofen can increase your risk for side effects. It can affect your kidneys, most especially if you're dehydrated or you have kidney problems. Parents often ask me if this medication is safe to be given to kids. The answer is yes, in some cases. It can be used for fever and pain when given in the right dose based on the child's age and weight, and that's why you have to follow the dosing instructions and never guess the dose. Another question I commonly get is whether ibuprofen is safe during pregnancy. Pregnancy is one of those situations in which you have to refer or ask your healthcare provider before taking several medications. Ibuprofen is generally avoided during the later stages of pregnancy because it may affect the baby and the pregnancy. And finally, if you have a history of stomach ulcer, stomach bleeding, kidney disease, and certain heart conditions, or if you're on certain blood thinners like warfarin or Eliquis, make sure you speak to your healthcare provider before taking ibuprofen. The biggest takeaway I want you to remember is ibuprofen is an effective medication that have helped millions of people every day. But just like any other medications, you have to make sure you use it safely and appropriately. Understanding what you're taking, why you're taking it, and how you're using it correctly can make a huge difference in protecting your health. If you have learned something new from this video, let me know in the comment section below. And if there is other healthcare topics you want me to talk about, disease states, medication, or just anything you might want me to elaborate more on, reach out to me or let me know in the comment section, and I'm gonna make a video about that next time. Don't forget to like, share, and subscribe with someone that might benefit from it. Thanks so much for being here and supporting me through this journey. I'm Corine, and this is MedTok with Corine, where healthcare is explained simply. Bye, and see you during my next video.